not the typical patient that comes to me who's significantly overweight, but you want to really improve your physique. And my goodness, you certainly did. Hey guys, it's Dr. Ryan, and today we're going to talk with one of my patients, Brian. Brian's been a patient of mine just about the past 5 months. He's going to tell us a little bit about his experience with the clinic. So Brian, why don't you tell us a little bit about yourself?
I'm a physician here in the Midwest. I'm 38 years old.
Right.
I was looking to make some changes with my health, and I reached out to a number of different clinics and got in contact with Dr. Ryan, and it's been a really good fit.
What exactly were some of the goals that you were trying to accomplish?
I think what was really important for me is to age in a way and get older in a way that my mind is still very active, my energy is still very good. Those things were very important to me. In my practice and what I do a lot of acute medicine. I work with people that are usually very, very sick. And what I found is that a lot of medicine is targeted at what happens when you already get sick or what happens when you already get a chronic illness. And so I want to find a way to stay healthy. And so I was kind of doing that on my own a little bit. But as I started doing it more, I wanted someone that was on the cutting edge and knew the literature and resources on how I can age gracefully, reduce my cardiovascular risk, reduce my risk for stroke or heart attack or dementia. A high quality of life would be the most important thing for me. No one knows how long they're going to live for, and we don't know the future, but I find myself fatigued, I had decreased energy, and I just wanted to change that. So I talked to a lot of different groups and kind of reached out, and they had a lot of different options that were kind of presented. And what we're doing right now is just really, really working well for me. And when we first talked initially, I knew that it was going to be a good fit.
As a physician yourself, what kind of made you think, okay, this physician, this clinic is the right choice for me?
One thing I found, on my own is that I really wanted something that was more than just someone who's going to prescribe for me. It's very, very difficult to fix one thing and not another. So what I liked about Summaup is that it was more than just about prescriptions or blood work or that kind of stuff. It comes with a fitness program, it comes, training regimen. It kind of came with more of a complete package. So I really, really liked that off the start. And then I also liked how labs are monitored in a regular pattern, quarterly. It's a nice way to track your progress and track how things are going.
Was there anything else in particular about Summaup that kind of drew you to the clinic?
The difference with this clinic compared to some of the other clinics that I liked is that there seemed to be a real interest in keeping track of current research or current data. Like, for example, when tracking lipids, for a much deeper dive into that, and it's really more nuanced than that. And so it really does take someone, or takes a group that is sophisticated and knows how to check that and knows what to look for. And so that was something that really impressed me and something that I really enjoyed about you guys' clinic when we first got together.
I would like to just take this opportunity to brag on you a little bit. So I was most impressed with your progress. First thing that I thought was just remarkable was the extent to which you were able to improve your lab values. As you can see, you just radically changed your lab values in the span of really just 2.5 months. Your apolipoprotein B, which as we all know is a marker of cardiovascular disease of atherosclerosis, you dropped significantly within that time period. Your total cholesterol slashed almost 40 points, really improved your triglycerides, 143 to 65. And then we still have a little bit of work to go on your lipoprotein A, but this is rather remarkable for me. This is a rather high value here at 255, and we're able to cut it almost to about 30% of its original value, which is really, really good, down to 99. I think we still have some work to do in regards to this, and we will, but this is a value that a lot of conventional physicians kind of feel that is immutable, is not changeable, but you proved them wrong. And I want to emphasize you did this all through supplements and diet and exercise, which is really, really cool. And I certainly can't take credit for your insulin sensitivity. You were very, very good to start, but you got even better. You went from a hemoglobin A1C of 4.8 to 4.4, a fasting insulin of 8.8 to 2.6, essentially rendering your risk of ever experiencing or getting diabetes 0. And whereas your lab values kind of tell part of the story, I'm really impressed by the changes in your physique. You came to me fairly lean, but we had a little bit of adipose tissue to cut off, and you were able to do that, make quick work of that by cutting down from 199 down to a low of 176, so almost 25 pounds in a short period of time, so really, really good. And then we slowly started to bulk you up by adding muscle mass. And The proof is essentially in the pudding with your physique. Not the typical patient that comes to me who's significantly overweight, but you want to really improve your physique. And my goodness, you certainly did. You can see in the pictures here, you've made incredible changes. Like you can clearly see your abdominal definition here, your shoulders and your triceps and your pecs are much more defined. And you have a lot more definition. You can see a lot of us tend to carry a lot of adipose tissue in our lower back, and you've kind of shredded that down, which is really remarkable. So outside of the biomarkers and the pictures, which are wonderful, what are some of the changes you experienced firsthand?
Well, I just want to say that the physique and the aesthetic photos is like an added bonus. What made me feel the best was having all those lipids that changed. That made me really just feel the best. I'm a physician as well, and so I know how important that is for my life and for my quality of life as I get older. You know, I was kind of trying to do that on my own, but it kind of goes back to one of the things that I really liked when we first got together, you know, over Zoom when we first talked, is because a lot of those changes or a lot of that discipline and stuff like that, it's very hard for someone to do that on their own. And I think that, you know, a lot of people have like friends or colleagues or peers, and you know, you kind of reach out and try to do stuff together. But yeah, I just want to comment that the improvement on my labs and all that kind of stuff, the aesthetics and all that, it's really because I think there's a really good support system. I like the app that we have together. There's really good feedback, all of that support and stuff like that. I've been using that app. I've been using your team and your resources that you guys have here, and that's probably the biggest help for me. So see my lab values get better, made me feel the best. So then, yeah, working out and eating regularly, there's been a lot of improvements as far as the way that I feel each day. I'm less achy, I have less pain, my body is moving a lot better. My gut feels a lot better. You know, when I eat, I feel a lot healthier. My energy, my clarity of mind, all that just feels just so much better than it did before.
But what are some of the changes that your friends, family, or even colleagues at work have seen?
People have definitely noticed I'm a lot leaner, and I definitely have a lot more, you know, muscle tone. My friend group, they've been kind of following along, and they're kind of interested in doing similar stuff now because they're actually kind of amazed by it too. The loss and stuff like that. They really like that. It's very attractive to them.
Did you notice any changes in terms of your clarity, your mood, your energy levels as well?
Yeah, oh yeah, definitely. I wouldn't really say it's one thing, but I would say that 3 months of being on a regular diet and working out regularly and stuff like that, I definitely noticed that things were very different. My energy felt a lot better, my mood felt a lot better, my skin looked better. Just a whole lot of different things just kind of all came at once. It just really feels really quite good, to be honest.
In conclusion, what would you tell someone who's watching this video and uncertain about joining the program at the clinic? What would you tell that person?
What I would say is that this clinic, this program, it's a commitment up front, but I think the commitment up front brings a lot of value. And you do get a lot more contact, I would say, with your physician or healthcare team than I would say most people are able to get. And I would say it's a lot more personalized and customizable experience than what most people get when they interact with healthcare. And I think that the experience and the style of medicine is what I think a lot of people really prefer. And it's really difficult to get that kind of access. And sometimes there might be some hesitancy about doing it online. I would say that the value that people get is really, really quite high. As far as the feedback, the lab values, the training program, they have a nutrition guy here named Stefan who's very, very good. They have a whole team here that's really quite good. And so I would say that it does feel like a big commitment up front, but the value that you get at this clinic versus some of the other clinics, I would say is very, very high.
Well, Brian, I really appreciate you saying all those kind of things about the clinic and myself, and I'm so thankful to have you as a patient.
Thanks. Yeah, me too. I appreciate it, man.